Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 62 of the Ask Dr. Angela podcast. Has everyone made New Year's resolutions that they've already broken? My New Year's resolution is always pretty much the same, and it is really to look better, feel better, and be better. And certainly part of that looking better, and I'm sorry, but I'm a bit vain, is now that I'm letting my hair grow out, I've been dyeing it. Just long and gray hair, that is. It's just not a good look for me. So ever since my mini-me asked me to let my hair grow, it's been a lot more maintenance. But the good thing is that so many people are saying, oh my gosh, you look so much younger with, long curly hair. So I think I might have to change my profile picture because I'm not that same woman with the short cropped, short do anymore. Now I've got like these wild curls, jet black, and I'm really kind of liking it. I'm actually kind of missing it, and I'm really happy that I went back to it at my daughter's recommendation. But again, the only drawback is having to dye your hair, and now I have to buy hair products. I mean, before I was buying shampoo like once a year. But anyway, moving on. Today we're talking about sex post-delivery. And I mean, that's a really common question, especially for my patients' husbands. They're like, oh my gosh, when can she start having sex again? And I'm like, oh my gosh, can you just give her a minute? Can you just like pump the brakes a minute or 2 or 3 or 4? But anyway, this is something that commonly comes up at the 6-week visit. And the 6-week visit, it's usually 6 weeks post-vaginal delivery. At that visit, we talk about contraception, what to expect with regards to that first period. And certainly the big thing is, oh my gosh, when can I start having sex again? And if I'm going to be really honest with you, most of my moms that are postpartum, i.e. post-delivery, this is not what's the first thing on their mind. Most of my moms are dead tired. They're new parents. They're barely getting any rest. They barely can put clothes on themselves. The house is disheveled. They're stressed. And really the last thing on their mind is having some sex. But for those of you that are wondering and that are needing to make this kind of happen, the one piece of advice that I always give my patients is make sure that you use a heavy lubricant, okay? I happen to be a huge fan of Astroglide over KY. Sorry, KY jelly. But anyway, the thing with sex post-delivery, especially in my moms that are breastfeeding, is that the vagina is still pretty much in a hypoestrogenic state, especially, again, if you're breastfeeding. Breastfeeding keeps you in this hypoestrogenic state, And what that translates to in English is dry vagina. So sex immediately post-intercourse or at that 6-week mark, for most people, is not fun. And the vagina will get back to being normal once all the hormonal fluctuations resolve and your hormone balance gets kind of back into an equilibrium. But again, those first couple of times post-delivery, not fun, vagina's dry, and it's hurt. So as one of my patients said, extra lube and a glass of wine, please. And I actually think that that's a pretty good recommendation. So hopefully that tidbit helps somebody out. The other thing that I think I really need to mention is the reason that we recommend waiting until you're at least 6 weeks is, number one, if you did happen to deliver vaginally, it takes your vagina at least that long to heal, specifically if you had any lacerations that required any type of repair. So having said those things, if you happen to have a question that you would like featured in the Ask Dr. Angela podcast, please go to www.askdrangela.com. That's AskDrangela.com. Click on the microphone on the right-hand side of the page and do what you do. If we feature your question, someone from my team will reach out to you and send you one of our bomb-ass t-shirts, okay? And if you want to check out our bomb-ass t-shirts, you can go on Facebook or go on my Twitter account, and tons of people are posting pictures of themselves wearing the t-shirts, which actually are pretty cool. So before I leave you, I want to leave you with this. Ruth E. Wrinkle said, "You live longer once you realize that any time spent being unhappy is wasted." So let's focus on the good. Let's focus on the positive. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 63.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.